Hello friends, this is Dr. Neetika Modi and along with me is the celebrated medical exponent Dr. Madhu Chopra, who actually needs no introduction.
A big hello to all of you. Although we come from diverse sections of the same medical field, Dr. Modi and I collaborated to strengthen each other's hands to find that healing touch which is so needed.
Together, we've created a holistic space at Studio Aesthetic where all dentofacial attention comes together under one roof.
I'm also cherishing Dr. Ashok Chopra's dream to bring state-of-art, top-of-the-line wellness facility to India. I have traveled extensively because of my daughter's career, and I noticed that the Indian holistic culture has seeped into every walk of life.
Almost 100 years back, Thomas Edison had said that the doctors of the future would not prescribe medication to their patients. Instead, they would guide them on how to maintain their frame through holistic ways of diet, nutrition, and well-being.
The future of medicine is in prevention, and that can only be achieved by adopting holistic, healthy lifestyle.
Well said, Doc. And that's exactly how we ideated upon Svastha, a doctor's approach to holistic health, where we talk to Indian doctors on how they blend in holistic ways with their integrated medical practice. The body hears everything the mind says. Make sure you feed it just the right things, positive thoughts, a great, happy frame of mind, and some good counseling. Today we have with us a mind whisperer, someone who's been dealing with mind since many, many years, 3 decades if I may say. We're so honored to welcome on Svastha, a doctor's approach to holistic health, Dr. Anjali Chhabria, renowned psychiatrist. Hello doctor, how are you?
I'm good. Thank you for having me here today.
You know, it's so incredible that India and the world is now waking up to mental health. Tell us, have you seen during the COVID phase a lot more people coming out of the shell, a lot more people coming out of the closet and seeking help?
Absolutely. So thankfully, the one good thing that COVID has brought is that it has changed people's concept of mental health. And people are now realizing that actually if your mind is okay, your body is okay. Because COVID made people really look inward. And you were all by yourself, you were locked in, you were facing so many crises, whether it is financial crisis, losing a job, parents did not have money to pay their school fees, their children's school fees. There were people who not only witnessed, COVID in their house, but actually lost family members to COVID. And just the sheer panic of getting COVID and dealing with the loneliness of isolation, where you have no other way but to look inwards. So thankfully people are now realizing that mental health is as important as physical health, and actually more important than physical health.
Absolutely.
Because if your soft board of the computer is gone, the hard board cannot work.
True. So well said.
Good speaking to you about this subject, Dr. Chhabria. You said people are more aware of it, but there's a certain segment of people who can't deal with it. And you see there's such a prevalence of suicides now at all age groups. With the slightest provocation, they are unable to deal with or face the hardships or the consequences of all these external factors that have come into their lives.
So first of all, what happens is that mental illnesses have always existed, but now because of media, because of social media, they also get highlighted. The other thing is somewhere parents, what we see is suicides which happen in India. Actually, you'll be shocked to know that 1/3 of all suicides that happen in the world happen in India. And most of these are youngsters in the age group of...
More than the farmers' suicide.
Absolutely. They are in the age group of say 18 to 30 years of age.
How sad.
In fact, suicide is the second cause of death in that age group, And many a times it may, people feel, but everything was all right in their life. What happened? Why
exactly.
did he or
What is
she...
the trigger?
So what happens is, first of all, there are many causes to this. One is that there are, in many cases, in 75% of the cases, actually there's an underlying mental health disorder which has not been picked up by the family. Because people
Pre-existing.
don't talk. Yes. People don't talk about it.
Mm-hmm. Right.
So even if a child is suffering from depression, he or she will not come and say, Mom, Dad, I'm depressed, take me to the doctor. They will withdraw. There will be no contact with the parents. They will reverse their sleep cycle. So they will sleep in the day and they'll be awake the entire night. And what are they doing? They are on social media. Now what do you see mainly on social media is other people's happy stories. And that makes you feel that everybody's life is happy, only my life is sad. And then they start getting thoughts of sadness, thoughts of depression, and they feel worthless, hopeless and helpless. So they feel that there is no help available. And because of that, they may be triggered to become impulsive. Again, the other cause over here is that a lot of these people, resort to substances because they're not getting medicine for the problem that they have. So they may drink alcohol, they may take other substances. Under that, they become more depressed. But most of these suicides are preventable if these people get help at the right moment.
So you mean the responsibility of the family, the friends, the peers, the teachers would help prevent suicides?
It'll help recognize the signs.
So how would you encourage this to happen in the real world?
So, say for example, shows like these, give the message that yes, suicide is preventable, because what happens is people feel that, oh, I couldn't do anything. Or he or she did not want to come. Ma'am had referred me a case where we worked so hard together because the person did not think it was important for her to take help.
And her family too.
And the family too. I think today a doctor's job, a teacher's job, a neighbor's job has become so much more, a friend's job. Many a times I have friends who will bring the person, or they just come themselves and they say, this person is not taking help. How do we deal with it? So people feel कि नहीं हम पागलों के डॉक्टर के पास क्यों जाएंगे? हम पागल थोड़ी हो गए हैं. So there is so much stigma about going to a mental health professional, but that is slowly going away. So what happens is people don't recognize the signs. Say in teenagers, when they are depressed, they don't say that they are depressed, they become aggressive. They withdraw from the family. The more the parents try to go and pull them out of it and say, oh, come and spend time, why don't you go running, jogging, they'll say we don't want to do anything with you, and they withdraw and they get angry. When they get angry, the parents to control them get more angry. So that leads nowhere.
Leads to abuse?
Absolutely, and there's abuse, there's physical abuse, there's verbal abuse, then they also go into substance abuse, which makes the situation worse.
Doc, do you feel somewhere the way parenting has changed in the recent years, is that also responsible? Because we are actually mollycoddling our kids a lot more than our parents did, and the kids don't really grow up to a no, and the minute they're faced with any difficult situation, they don't know how to cope with it. So is this something to do with we need to look back at how we are parenting our children?
I think definitely what is very important is that we have to be firm and nice with our children. Firm and kind. So when you say firm, that means if your child is asking you for something and you cannot give it to him for whatever reasons, or you do not think that it's appropriate for him, it should be no the first time, it should be no the 10th time with the same tone. So what happens is, if you say no, yes, then the child knows that I have to
tantrums.
Yes.
You get me?
Yes. Sometimes what happens is that we want to give our children everything that we haven't got.
So true, yeah.
As kids. So in that we feel, no, I will go without this, but I will give my child this. So I think it's important to also, get them up in a balanced way, because the most important word is balance. If we can balance the fact that yes, I can get this, but I don't need it. Or even handling failures. We've all gone through failures in life, and how we handle them. We don't get so shaken up.
True, yeah.
But here, if the failure is highlighted, and the child is not taught to deal with the failure, that's when we feel them that, oh, they're not able to deal with any failures in life, and they start feeling absolutely unworthy of themselves.
I want to start the subject of postpartum psychosis, postpartum depression. Have you seen a bigger prevalence in unwed mothers, young mothers, or single mothers, or which age group, and why? What is the genesis of postpartum pregnancy? Everybody doesn't get it.
Right.
Why does some get it, and how do you deal with it?
So first of all, after pregnancy, after delivery, 50% of women go through postpartum blues. That means they start feeling low, they have mood changes, they feel they can't take care of the child, they may have sleep disturbances, and they may be crying at at every little point. But postpartum depression happens to 10% of women.
Okay.
And actually it can happen to anybody. Of course, somebody who has a history of any mental health condition before this. So for example, say an unwed mother is anyway going through so much stress and anxiety. Single parent is going through so much stress because they don't know how they're going to be able to take care of their child. So in such people, it can happen more. But yes, there could also be genetic precursors. It could also be that you had a very difficult pregnancy, or the child is a very precious child because a mother who is lost 2 to 3 children before, can have proper depression. That means that the mood symptoms will go on for a few weeks. The postpartum blues, they become all right in a few weeks, but postpartum depression goes on, where the mother feels worthless. She feels, I can't take care of the child. She starts thinking that maybe the child has problems. She'll keep calling the pediatrician for every little thing. And what is worse is that if it becomes postpartum psychosis, that happens to only 1 in 1,000 people, in 1,000 mothers.
Okay.
At that time, they actually start feeling homicidal or suicidal.
Oh my God.
So sometimes when we read that the mother threw a child out of the window, or I knew of one lady after her delivery took all 3 children and went to the tracks to kill them, and 2 out of the 3 kids survived, and she was left with the guilt that this is what she had done.
Early, can an obstetrician or an antenatal caregiver figure out that this lady is having emotional issues which may further lead to postpartum depression? Is there a way that this can be diagnosed before she delivers?
Absolutely. So what happens is, this is my chat which I have with all my gynec friends. I tell them that when you are looking after, the woman is coming to you, have a counselor sit there in your office, just checking on them, asking them the relevant questions. Are you sleeping well? Are you eating well? What are your concerns? Sometimes people are concerned that they're going to look ugly all their life, they will not be able to lose the weight, that their husbands will go away from them. All the expectations, in our country we also have this girl-boy expectation which is slowly going away, but people are so worried about it.
In my practice, I've seen prescriptions from other doctors, GPs, non-medical practitioners, trainers, all of them, they give medicines free will, OTCs, and not even OTCs, the doctors give prescriptions. And invariably 6 out of 10 have antidepressants or sleep aids added to it. You think it is wise, it is legitimate, should it be done that you give these kind of...
Not at all. So, the most common medicine which is given, is a sleep aid. Okay, so benzodiazepines. Okay, I've had families in which the 14-year-old to the 84-year-old grandmother, great-grandmother, all of them are taking sleeping pills.
It's like this is, if you have a good night's sleep, your life is fine.
Yes.
I have a
but
patient
actually, insomnia is the first symptom. Because when you are disturbed, when you have anxiety, when you have depression, you cannot sleep, or you oversleep. Okay, so if that insomnia is looked in, so my talk to general physicians is that, such people, when they say, oh doctor, please give me a sleeping medicine, is that, you call them when you have time and try and understand what is happening to them. And at that time you tell them, like just as I would send you to an orthopedic if you had a fracture of your leg, similarly I would suggest that you go and see someone who treats the fracture of the mind, because depression is a fracture of the mind. So instead of just giving medicines that you have no knowledge about, it's better that you give time to the person and convince them. We also have certain tests.
I've lost patience because I did this.
Yeah,
कि उस डॉक्टर ने तो इतनी अच्छी दवाई दी. Now you're telling me not to do it without specialist consultation.
Yes,
I said, then fine, I'm not going to a psychiatrist.
But I'll tell you, the same thing I was discussing with a gynec. They're saying, oh, but मेरे पास नहीं आएंगे उसके बाद. I said, but tomorrow if you get the news that that person has jumped off the 25th floor, will you be able to sleep?
So in the doctor's minds, they're actually helping a person who's showing signs of early depression or
No, see, one can give benzodiazepines, but they should be not given for more than 3 weeks. So you can't keep giving it and, hoping, It's like if I take a paracetamol for a toothache and hope that, no, there's nothing inside. It'll become all right. what are the chances?
Absolutely. Dr. Anjali, that brings me to the next question, which is, at the clinic, we see patients complain of pain. Now, pain is something that, could be in a different variation with each person depending upon his pain-bearing capacity. Yeah. After you've done treatments, and we've seen a few cases where in spite of everything the pain continues.
Yes.
And that's when you know that there's a psychosomatic reason for it.
Right.
But like she said, if we do tell them that you may need to go and see a counselor, that's the first time they doubt you and they say no,
My pain is real.
My
Yes.
pain is real.
Yes.
So what can we do for such cases?
So, we have psychological tests. So, what I suggest is that, if you can just tell them, can you fill up this form? It will take you half an hour, 45 minutes. Now, when they fill up the form, there's a report that comes at the end of it where you can tell them that, are you going through some anxiety? Okay, and explain to them. By telling them that because of anxiety, your muscles may become tight and your pain may become. So
magnified.
what happens is, when people say, oh, your pain is not real, that is when the problem is, because they feel, what do you think, I'm imagining the pain? Typically when a person gets a panic disorder, when they are getting anxiety attacks and when they go to the hospital and people do an ECG and they'll say, nahi, ye sab theek hai. Sab theek nahi hai. The person has actually got the problem. But that is when we talk to them about neuroreceptors where because of less serotonin, you are getting more pain. So, instead of what happens is how we say it is very important.
So I think it should be a good idea to keep her forms in the clinic.
Yeah, exactly.
Each time there's
Besides that, is there an intermediary between a GP or a referring doctor and you?
Right.
Should there be an intermediary who's not so scary to the client?
Right,
Do you have that kind of?
So we have psychologists working with us, and what we normally do is whenever anyone comes to us, first the psychologist takes a full detailed history, then I see the person. Now the rapport is already being formed, and the first step is when people come and see you and realize that you're not so scary, and also the people around you are not scary at all. In fact, there are normal people sitting in the waiting room. That's where the stigma slowly starts going away and they become friendly with the psychologist.
So if we need to get rid of this stigma, this apprehension about seeing a psychiatrist, are you in favor of making it so easily available and accessible that you go to a school, you have a counselor, you have a psychiatrist, you go to a workplace, a corporate, everybody, if it becomes mandatory, maybe it will take away all this stigma.
Absolutely right, and we are waiting for the day. We've been working with schools.
Are you doing something like that?
Yes, we've been working with schools. I have a company which looks after corporate needs, and the amount of work that we've done in the last 1 year, where we are talking to people and telling them. Because what also happened in the lockdown was that people would need coffee to wake up and take alcohol or sleeping pills
Yeah,
to
uppers
sleep.
and downers, they're doing it.
Crazy.
So one of our jobs was to tell people, to have a regular sleep hygiene,
Turn off
eat
technology.
well. Yes, to turn off gadgets. And we are hoping that just the way our country has looked after COVID so beautifully, literally they've gone into every house.
Held it by the horns and
Yes.
actually.
Similarly, if we can have a mental health revolution in our country, thankfully,
That'll really help.
for people
That'll
like
really
you.
help.
Should we make it mandatory to get a license for a business if you have a counselor? These are the things that
I
are
think that's a
absolutely must.
fantastic
Certificate
idea.
लेकर आइए कि you have a
Yes.
counselor on board.
Yes,
फिर आपको
yes.
license मिलेगा. For every
Yes.
little thing you have like 500
True.
documents that you have to
Yes,
fulfill
yes,
for every
yes.
license. They should
Yeah,
add this
no.
also. I think
I
it's so
think it's a
important.
fantastic idea. I'm waiting for a mental health minister in our country.
No, even the health minister
yeah,
should be able to.
Anjali, are women more closeted? And like we've been talking of hormones, it's the woman who's most affected, menopause, menarche, pregnancy. The hormones are always, flowing
over.
up and down with women. The woman of the house is the focus. If she's good, then the family will
Absolutely right.
How can the family look after a woman's needs? Because, she may be going through menopause and she may be losing her cool, but the kids retaliate each time she says something. So,
Right.
how can we be more gentle on the women, and how can we get the women to come out with their problems? Because they fear being labeled even more than the man.
No, in fact, it'll be interesting to know that, we've all heard of farmer suicides, but 25 times more there are housewives who are committing suicide. Okay, and that's just because the depression has not been picked up, or mental health issues have not been picked up. And the woman is the most important part of the house, because if a woman is happy, the husband goes happier to work, the children are looked after well, they grow up to be healthier, happier human beings. So it's very important to pay attention to girls, to young women, to older women, especially when they are going through hormonal issues. And it is important for other people to realize it and to gently take care of them, to hear them out, to spend time to try and solve their issues, and also take them to a mental health professional whenever the time is right.
What can a family look out for that they feel could be the signs of their mother or their wife requiring help?
So, sleep issues, okay, appetite issues. These days we see a lot of women striving for that body, and in that they go through yo-yo diets. I mean, of course, even men do it, but what happens is, so when she is feeling irritable or she is very restless, and getting upset with everybody, these could be, or getting into, getting suspicious. So many a times I have men who say, my wife is very suspicious, and I tell them this is a disorder. She's not a bad person. What happens is people start labeling these women as bad people. I actually make them go through a checklist and say that, she's sad, she's not bad, and she's not mad,
Right.
and we have to get her to get help.
Great, very nice. It was such an insightful conversation with you, and we opened up literally a Pandora's box here on a subject that people are scared to step into and even talk about. And it's so nice that through this forum perhaps we'll have more people coming up and knowing when to start their consult. At what point do they recognize that they need help, which has to be by the person himself. Someone else, of course, could help, but you have to recognize yourself, this is a point I need help, I should get help. So thank you for bringing it out and making it so easy and simplified.
Thank you.
That's what we're trying to achieve with Svastha, a doctor's approach to holistic health, that as doctors, we're not just treating the physicality of the person, not just the physical, because holistic health is about the physical body, the mind, and the soul. And thank you for touching upon the most important part, the mind of a human being.
Thank you for having me here, and thank you for having such beautiful conversations which are going to help so many people.
Thank you.